Hello, I'm Dr. Aizaz from MedicoVisual.com, and in today's visual lecture we will talk about that why there is the formation of this facial colliculus and why the facial nerve proper fibers or facial nerve brachiomotor fibers, why they wind around the sixth nerve, the sixth cranial nerve, abducens nerve, why they have this intimate relationship with this sixth nerve, sixth cranial nerve. So why they have this intimate relationship? That is the question of today. So here we have, what is this? This is the facial nerve proper nucleus, facial nerve proper nucleus or facial nerve motor nucleus, right? So then here is the abducens nucleus, and forget about it for a minute, right? So here you can see what is happening, that this facial nerve proper nucleus, the fibers, they arise from here, they go back, and then they wind around, they loop around, or they circumnavigate around the abducens nerve nucleus like this, and then they come forward. Opposite to that, the fibers of abducens nerve, they simply come forward like this. Here as well, they simply come forward like this. I haven't shown these fibers, but basically they simply come forward like this, ventrolaterally like this. They do not loop around and do these weird things, right? But what's wrong with the facial nerve? Why its motor fibers, especially in other fibers, do not do this? Why its motor fibers, they loop around the sixth cranial nerve? That is the question of today. And by the way, as they are looping around like this, what is happening here, that in the floor of fourth ventricle, this is the floor of fourth ventricle, here there is the formation of this swelling, right? So due to this looping, you see the looping leads to formation of this swelling in the roof of fourth ventricle in the pons region, and near the pontomedullary junction in the pons region. Here we have this swelling called facial colliculus. Facial colliculus, as you might be knowing, that it is formed by the abducens nucleus. Along with that, the looped fibers of the facial nerve, as these fibers are looping around the facial nerve, around the abducens nucleus, then this facial colliculus is formed. So that is the question, that how it forms. So now that we have understood the question properly, let's try to answer it. So let's go back, and here we can see the basal plate as well as alar plate. Now we will not focus on alar plate or alar plate, we will only focus on the basal plate. So from the basal plate, here we can see that two nuclei develop, actually three nuclei develop, but I haven't shown the third one because our focus of attention should be on these two nuclei right now. The third one is, by the way, the superior salivatory nucleus. Let's forget about that for a minute. Now initially you see that we have this nucleus, facial nerve proper nucleus, here as well, and this is the abducens nerve nucleus. Initially you can see that this nucleus, it is lying dorsolateral. This is medial side, this is lateral side, and this is the midpoint, right? So it is lying, by the way, this is dorsal and this is ventral, so it is lying dorsolateral to abducens nerve nucleus. So during embryonic life, it develops dorsolateral to abducens nerve nucleus. But what happens, that it of course forms the axonal fibers like this initially, right? But later what happens, that as its fibers are formed, it migrates like this, and as it migrates, Larson has put it very beautifully. Larson writes that as it migrates, the facial nerve it reels out its axonal fibers. So here you see it is reeling out its axonal fibers, and if we follow these axonal fibers, we can actually trace the migratory pathway that initially it was here, but as it reeled out, as it migrated, it continued to reel out the fibers from its backside, and this lead to this type of arrangement. So this answers the question that why it happens. Basically, the reason is that its axons, they form before the migration. That is important point, that even before the migration starts, its axonal fibers, they do arise. But as the migration continues, the axonal fibers, they still remain there, and basically these fibers, they lengthen out, you can say, or as Larson put it out, that they reel out from its backside. Now here two important question arises: why there is the need of migration? Why migrate ventrally when it can remain here? Why migrate ventrally? Number one question that we should answer. Number two question is that, okay, let me first draw a diagram for you, that we have in the medulla, we have this nucleus ambiguous, and we have at the medial end we have the general somatic efferent nucleus, that is the hypoglossal. Here general somatic efferent is Abducens nucleus. In medulla, the general somatic efferent is hypoglossal nucleus. In medulla, the special visceral efferent is nucleus ambiguous. But here, special visceral efferent is facial nerve proper nucleus. Now the thing is that we have this again a ventrally displaced nucleus in medulla as well, but this does not form any type of weird colliculus. It does not have this type of weird looping thing. It does not have any intimate relationship with hypoglossal nucleus. It's just simply it comes out like this. It does not follow this type of pathway. It does not loop around. It does not circumnavigate its general somatic efferent. So why is this situation? Why is the facial nerve nucleus so horny, and why the nucleus ambiguous is not so horny? Facial nerve nucleus is going to form the intimate relationship with sixth nerve. But nucleus ambiguous is innocent, isn't it? It is not doing anything like that. So why nucleus ambiguous fibers do not loop? These two questions that we must answer. These are the follow-up question after we answer this basic question. Why it migrates ventrally? This is relatively easier to answer. The reason being that one of the reason is very logical and other is rather hypothetical or speculative. The one reason is that these nuclei, they tend to follow the column-like arrangement. Basically, if we draw the like this, that this is pons, this is medulla, this is pons here as well, and this is medulla. Now if we see vertically, that in the midline we have this hypoglossal nucleus. Near the midline we have hypoglossal nucleus in medulla. This is general somatic efferent nucleus. But if we trace this column cranially, then we will see that we have here in the same column, in the same vertical plane, we have in pons, we have what? Near the pontomedullary junction, we have another general somatic efferent nucleus, which is the sixth nerve nucleus, which is the Abducens nucleus. Now very similar to that, ventrolateral to it, we have the nucleus ambiguous here. So let's draw the nucleus ambiguous. Ventrolaterally we have nucleus ambiguous here like this. And in this same vertical column, or in this same vertical plane, superiorly in pons, we have facial nerve proper nucleus. And if we further go upward in pons, almost in the mid-pontine region, we have another brachiomotor nucleus or special visceral efferent nucleus, which is the nucleus of trigeminal nerve. So all these, you can see that all these are basically following this column-like arrangement. They are arranged in certain columns. So the logical reason that why it is migrating facial nerve nucleus proper, why it is migrating ventrally, is that they have to follow the vertical plane of other special visceral efferent columns. I mean the column of the trigeminal motor nerve nucleus and the nucleus ambiguus. So that's why it migrates ventrolaterally. And why all these migrate ventrolaterally? That is another question. One of the reason may be, no, it's a speculative reason. One of the reason may be, again, it's a speculative reason. Now this reason is not 100%, I'm not sure about this, but in the spinal cord we do not have special nuclei or special horns in spinal cord. By the way, we do not have nuclei, we have continuous column. But anyhow, in spinal cord we do not have the column, we do not have special column, we do not have special visceral efferent or special visceral afferent and so on. We only have general ones, right? So because the column is not there, so as the transition occurs, they have to somehow, they cannot fit in this regular schema of the spinal cord. The regular schema of spinal cord is broken, and they have to break this schema, and they have to somehow come to lie at some other place. And the other reason might be, I'm not sure, even some authors mention that as the reticular formation forms and lots of fibers are there may be the lack of space here. So the lack of space might push these nuclei ventrally, right? So lack of space might push these nuclei ventrally. But again, it's a speculative reason, and this answers our first question. And by the way, regarding the second question, why nucleus ambiguous fibers do not loop, also we can see that trigeminal fibers, the trigeminal motor fibers, they also do not loop. So we can also add the trigeminal motor nucleus here, TMN, right? So why they do not loop? So again, no, the answer to this question I am not really sure about. It's again a speculative answer, but if we do not know, why can't we make an educated guess? Let's try to answer it logically, and let's try to make educated guess. But again, the disclaimer here that I am not 100% sure of this answer. Facial nerve proper nucleus, that before it started migrating its fibers, its axon, it arises, right? And then after its axon has arisen, then it migrates and it continue to reel out its axon. So that is why the situation is like this. Now the thing is that these brachiomotor nuclei, they are going to supply fibers to pharyngeal arch derived muscles, and pharyngeal arch, they derived serially or sequentially. So for example, first pharyngeal arch developed first of all, then second develops, and third develops, and then fourth followed by sixth, right? So the first one develops, and sixth is the last one that will develop at the last, right? Last in the timeline. So now here is my assumption that all these nuclei, whether of the medulla, whether of the pons, they are derived from basal plate, which has already arranged, and all these nuclei, now I am assuming this, I do not have proof of this, right? I am assuming that all these nuclei, they developed almost at the same time, right? They developed almost at the same time. Now the thing is that, again, I am assuming here that as the facial nerve proper nucleus has developed, the pharyngeal arch has also been developed here. So let's suppose here is the pharyngeal arch. So pharyngeal arch has already developed here. That is what I am assuming. I mean second pharyngeal arch, which it is going to supply. So as this pharyngeal arch has been developed, this pharyngeal arch will secrete certain factors. These are called neurotropins. So it will release certain factors which will cause the axonal elongation, and it will cause the axons to develop towards this second pharyngeal arch like this. But this is the time I am assuming that the nucleus ambiguus might have developed, but its pharyngeal arches to which it has to supply, those pharyngeal arches might not have developed. So because those pharyngeal arches might not have developed, so that is why the axons, they might not have arisen. The axons from the nucleus ambiguus might not have arisen before it migrated. So here the axon they reeled out before it migrated, right? So as it migrates, the axon will follow. But in nucleus ambiguus, the axons develop later because the pharyngeal arches that it has to supply, they also develop later, presumably, right? So that is why, because the axon arise after the migration, so assume that migration has occurred. Now the axon arise. Now this is, let's suppose, the nucleus ambiguous. Now let's suppose that this is, let's forget about this axon. So let's suppose this is the nucleus ambiguous. So now let's suppose that migration has occurred. Now let's suppose if pharyngeal arch develops, and now let's suppose it releases the neurotropins. Now these neurotropins will say, okay, come on, quickly pull out axon. So quickly pull out the axon, right? So they will simply come out straight like this, or at best they will sort of loop like this, but they won't need to loop like this, because they have formed after the migration. In case of facial nerve proper, they are formed before the migration. By the way, this is fact, this is acknowledged fact, this is a well-known fact that the axons, they arise before migration. So in this lecture, few things are speculative or hypothetical, but few things are the facts that are discussed already in the textbook. So it's a mixture of speculation or hypothesis. Along with that, some facts are presented in this lecture. So yeah, what I was saying is that the thing is that the facial nerve proper nucleus, its axons, they arise before migration, but in case of nucleus ambiguus, its axons, they arise after migration. But what about the trigeminal nerve nucleus? The trigeminal motor nucleus, it is going to supply muscles of mastication, which, if I remember correctly, they arise from the first pharyngeal arch. They do not arise from third or fourth or so on, as in case of nucleus ambiguus, because in the mid-pontine region we do not have general somatic efferent nucleus in its migratory path, because it does not have any general somatic efferent nucleus in its migratory path. Even if the axons, they arise first, it does not matter. They have nothing to loop around, so they cannot naturally loop around anything, right? So I think that answers the question for you. Hopefully you learned something from this video. Thank you so much for watching this video. Have a great day. Goodbye.